Patients carry a lot of guilt, shame, and blame. The culture that we find ourselves living in helps us carry that guilt, shame, and blame. But these conversations we know really help lift that. We see it happening every day in the Berry Nation community. We see it happening in the greater community. And when patients and providers can connect around the meaningful treatment of the disease, we can really start to lift that. We can feel that we can move forward and make progress.
Yeah, I think that's the main thing, is for people to understand that obesity is a disease. And my dear friend, Teresa Lemasters, who was president 2 years ago at our recent obesity summit, where we gathered a lot of different doctors and providers and organizations and industry partners to talk about what we can do to try to move the needle to get more people help. She made a great point. She said that obesity is something that can be treated, it should be treated, and it deserves to be treated. And we really have to get that message out.
That is a perfect place for us to maybe start this conversation, right? So exactly what you said, it deserves to be treated. Why then do only 1% or 2% of people who qualify for bariatric surgery undergo the procedure?
I think it's being hit from all sides, because not only do a lot of doctors not necessarily believe that it's a disease, but even if they kind of believe it's a disease, they think it's something that patients bring upon themselves. And they may not think that consciously, but somewhere deep inside, they're thinking that, it's volitional. It's something that patients could do something about themselves. And while doctors are thinking that, families are thinking about that, patients are thinking it themselves. Patients are ashamed, and they're thinking, oh, if only I could just stop eating. How do you stop eating cold turkey, right? You can't. You just can't. And you're hungry all the time, and you're thinking about food all the time. So it's terrible.
Yes, it is terrible. And I know as a patient, I carried that guilt and shame around with me for a very long time, and for decades. I thought that I was 100% in control of what was going on. Yeah, and I was not.
And how is it that you would choose to be heavy and to eat too much? Why would you want that for yourself? Of course not.